felt that excruciating pain in your abdomen that just won't go away? It could be kidney stones. In celebration of Kidney Month, we are joined by Dr. Jeanette Ybiernas, a nephrologist, to talk about kidney stones.
June is National Kidney Month. Indeed, a great pleasure to share with you a topic that is very dear to my heart, all about kidney stones. Dealing with kidney stones is a very common but painful condition affecting many Filipinos. We live in a very humid and hot climate in the Philippines, so we are all at risk. It is a painful condition because the textbook describes passing out kidney stones as undergoing childbirth without anesthesia. Take note. Since kidney stones are more common among men more than women, between the ages of 30 and 50, at least men can also experience the pain of childbirth if they pass out kidney stone. So kidney stones develop by forming crystals in the urine. If the crystal remain small, like the size of 4 millimeters, they travel through the urinary tract and pass out spontaneously without causing pain and symptom. If the crystals are larger, more than 4 millimeters, this can impair kidney function, obstruct the flow of urine, and cause pain and symptom and discomfort. If stones obstruct the flow of urine, this can cause recurrent infection or UTI or even kidney failure. The top 3 types of kidney stones are calcium stones, uric acid stones, and struvite stones. For the calcium stone, the most common type of stone are calcium oxalate stones, in which you can get this from high oxalate-rich foods such as spinach, kangkong, dark chocolate, dark tea, and even sodas. The next type of kidney stone is uric acid stone, and we all know the foods rich in uric acid: laman loob, red meat, nuts, and others. The other types of kidney stone are struvite stones, and we can get struvite stones from recurrent infection or recurrent UTI. And this kind of stones are difficult to treat medically. They're very hard, and most often you need surgery or operation to remove the stones. Who are at risk for kidney stones? As I mentioned, high oxalate diet, high red meat consumption, high salt intake, and lack of water. These are the people who are at risk for kidney stones. If we talk about salt, it should be at least 1 teaspoon or less a day. If we talk about water, we should drink at least 2 liters of water or even more. The other risk factors are genetic or a strong family history of kidney stone. So we should know our risk for kidney stone. And it's true that once a stone former, always a stone former. Because even if you pass out the kidney stone spontaneously, chances are it will recur within 3 years' time. The symptoms include pain in the lower back, and the pain will radiate to the groin or the signet. And for men, the pain will radiate to the scrotum. The other symptoms would be the symptoms of UTI or infection in the urine. You will have problem in urination, like pain or discomfort during urination. And sometimes you will pee blood or your urine becomes bloody. How to diagnose kidney stone? Kidney stones can be diagnosed by doing ultrasound of the kidneys and urinary bladder or KUB ultrasound. We also examine the urine and check for blood in the urine or pus cells if you have infection. We also test for your kidney function, such as checking for your serum creatinine. We also check for the uric acid and calcium level. And if the stone is really bothering us, like if you have symptoms, we can go higher in the imaging study by doing a CT scan of the kidneys, especially for smaller stone, so we can at least identify the location. For treatment, the treatment for kidney stone is mostly lifestyle modifications because the risk would be obesity, and of course lifestyle. So we have to lose weight and we have to eat less meat and low salt diet as well, and we have to increase our water intake as I mentioned. However, if the pain is really severe or the stone is larger, we can use medications to dissolve the stone such as potassium citrate and sambong. But for very symptomatic patients, we do non-invasive procedures such as ESWL or shockwave therapy or laser therapy. However, in some patients, especially with impaired kidney function, we can do surgery. It can be open stone surgery or basket extraction. We can beat kidney stone by following healthy lifestyle, stay well hydrated with water, know your risk for kidney stone development, and consult your doctor. Lastly, let's stay informed and stay proactive. Thank you so much.